So hi to all our viewers, and today we have with us our proud achiever, Dr. Shah Yash Rakesh, who has achieved a stupendous All India rank 19 in the NEET SS 2022. So a big congrats to you, Dr. Yash. How are you feeling right now on seeing the results?
Thank, thank you so much, sir. So, sir, I feel blessed to get such a rank after working hard. I wanted to take up certain qualities, and with this rank, I may be able to get those qualities. So, I'm happy for that.
So you're definitely secured. You can choose your branch of your choice in any college across India. So a rank
Yes,
19, even in the years before when we were conducting the specialty wise, even then rank 19 would be an extremely good rank. And getting a rank 19 in a clubbed exam where thousands of students write the exam simultaneously, it is no mean achievement, and it itself is a great achievement. Once again, big congrats for you.
thanks, sir.
So tell me, the viewers would want to know more about yourself, where you're from, where did you do your MBBS and MD from? Can you just brief on that?
So, sir, to everyone, I am from Gujarat. I did my MBBS from DC Medical College, Ahmedabad, and then I did my MD from Maulana Azad Medical College in Delhi.
Okay, fine. So you passed out only this year, right?
Yes, I passed out in April 2020.
So how was it, right? Balancing your ward work, your clinical duties, and alongside preparing for NEET assist. So how did you manage the time and all? Because a lot of students who are fresh from their residency would be appearing for the upcoming NEET assist also. So how did you manage both the duties as well as your preparation?
Yeah. So, sir, both our and our junior batches our clinics were affected very much by COVID. So during that time, we had a lot of free time during which we could read. Also, it was not clear whether we would have a general pattern in our NEET SS exams or we would have specialty pattern. So first of all, we were deciding whether we should read for that specialty or not. But because our clinics were hampered and during our third year we were more into clinics than we would like to have, so we could not read about the specialty exams and we read much more about general NEET SS preparation only. But we did not do any focused preparation before this because we were just focused on clearing our MD exams. And then after this, after our exams got over and we got our results, we decided that we can clear the NEET SS exams this time around. And so we started to read up Harrison based on the NEET SS patterns and solve MCQs in coordination with that. And then we did this time around. That is what we did this time around. So that is why doc tutorials help in that way that solving MCQs helps. We have not got that MCQ focused preparation. We have not done that preparation 3 years since the past 3 years. So we would read up in a very clinical manner. We would read up dosing, we would read up side effects, which are not really helpful in NEET exams. Syndromic questions and all of those questions were higher on the MCQ list this time. That is all these things that we do not read up for our clinical practice. So that helps when you read up from a NEET SS point of view. And the next batch, because they know how the pattern is going to be, maybe they can read up sooner so that we can achieve the ranks like in the first round.
So in that small window after finishing your MD with your NEET SS exam, between that window itself, you were able to successfully do a great preparation and do a good revision as well, and end up with a excellent rank. So once again, congrats to you. And this year was special for the reason that there were a lot of ambiguity and uncertainty regarding the pattern of the exam. A lot of students would ask us, sir, what would be the pattern like? Will there be more of a one line or a factual based questions, or could be more of a clinical scenario? Because when I gave my NEET assessment some years back, it was mostly one liners and factual questions. But over the years, there has been a change in trend where the last year up to 60 to 70% of the questions were clinical based. So at the exam day, when you saw the first 20 to 30 questions, what was your thought process like? So did you expect that paradigm shift in the question pattern, or were you prepared for that?
We have given our NEET, UG, and PT exams, and all of those exams, when they were in a general pattern, sort of club together pattern, most of those exams have been one-liners. So we were more or less, at least me and my friends were more or less prepared that our exams, the questions would be one-liners rather than clinical questions because they cater to a broader audience. So that is what we felt, sir, and that is how it turned out to be.
So you've
Uh,
all okay. Okay, you continue. Continue.
sir, basically, we thought that the doctoral exams in the last part of the exams, last leg of exams, were also one-liners, sir, more so one-liners rather than clinical questions. And truth be spoken, sir, clinical questions we can handle because we have seen patients, known patients. So clinical questions are easier to solve. One-liners we either know or we don't know. So it is better to prepare for one-liners. I think clinical questions over these 3 years, we can kind of get to know how to solve clinical questions, how to deal with those. The only issue about clinical questions is that they are opinion based sometimes, and it is difficult because sometimes the answers are not from guidelines. They are based on certain kind of opinions. So that is what makes clinical questions difficult. Otherwise, one-liners are purely data driven, and because we have such a we have Harrison, which is such a data-driven book. We can just read up from that over the 2 years and get a very good knowledge. So I have suggested all my juniors to read up from Harrison only, and then maybe they can do this MCQs, solve this MCQs, and then prepare on the top of those data.
Okay, actually, a good point that Yash has brought up. In our doc tutorial question bank, we have meticulously given our attention to include both the one-liners, the factual-based questions, as well as the clinical-based questions in a good and equitable proportions. And we have at one thing that the viewers should understand is that there is no clear distinction between these clinical questions and these one-liners. Sometimes the that one-liner, that point in the one-liner could be the essence of solving that clinical case scenario. So that the line of demarcation is actually very arbitrary. And if you know your concepts well and plus know enough of the data, you will be able to solve most of the questions. So you have already said that you covered the Harrison from cover to cover. And apart from Harrison, did you resort to any specialty book? Did you read any specialty books for NEET SS preparation? And what do you
No,
think is
not
the approximate proportion of questions that came from Harrison in your exam?
sir, I think around 15 to 20, or about 25 questions were not from Harrison. I don't think more than that number. We should think about. We should not think about those questions because those are the kind of questions that we cannot get even if we read extensively. So rather than focusing on those questions, I think we should focus on the questions that really matter. That is about 120 to 125 questions which are from Harrison. And even if I got this rank, the differentiator was that I got 5 to 6. I made 5 to 6 silly mistakes. So I think cutting down on those silly mistakes and remembering the data that you have read is much more important than focusing on the rare questions because you cannot get those rare questions any day. Even if I said for 1 year and I tried next year, maybe I won't get those questions. So when you have less time, when you have 2 to 3 months, to focus on what you have, work on your weaknesses, and rather polish your strengths. I think that is the way to go.
So excellent point put up by Dr. Yash, because when you have a limited time and so many subjects to cover, it is not possible to go behind all the specialty books. And that is why we in doc tutorials, there are specialty faculties are there. So we will be giving in the Q bank as well as test series the important points and questions from Harrison. And there are certain areas which you can expect out of Harrison. So we will be specifically carving out those areas and will be giving specific video lectures as well as questions from those important areas from specialty books so that you no longer has to go beyond or go behind that specialty books. So you have subscribed to the doc tutorials Q bank as well as the test series. So were you in a habit of regularly attending all the grand tests given by the doc tutorials? Did you give all
Yes,
the
sir.
tests?
Yes, sir. In the beginning, I did not. I was not able to because I was reading up for the first time. So I was giving exams, but I think at 3 weekly or 4 weekly intervals in the
Okay.
beginning. And I think GTs or top tutorial GTs were at 2 weekly intervals. So I
Yeah.
could not give around 3 to 4 of those, but in the end, I gave as many as I could
Okay.
because there was some interesting mixing up of pattern also. I think there were 2 or 3 image-based tests as well, and everything helped. Although our questions were not very image-oriented, but I think it helped to mix it up. In the end, it was nice.
How did you perform in the grand test, like in the final exams that you gave? What was your rank like?
Yes, so sir, my rank in doc tutorial GP was consistently in the top 10.
Top 10,
So,
and
yeah,
that actually mirrored in your final result as well, because when you see the all the topper interviews, you can see that all those who have got the ranks within top 50 or top 100, that was their rank in the doc tutorials GT as well. That means all the top students from across the country have subscribed to doc tutorials, and you would get a clear idea regarding where you stand. And one important point, that even though Dr. Yash was not able to give all the doctoral grant test initially, maybe due to his hectic schedule. So he was regularly giving the test during the latter part of the preparation. It is very important, because it is not only important to keep on reading and assimilating your knowledge, but it's also important to practice MCQs regularly, and and have a clear understanding regarding your weaknesses, where you stand among the peers. So that would give you a definite chance of improving yourself, identifying the weak areas, and improve upon it. It's an excellent point, Dr. Yash. So that's about your preparation. Now you have got an excellent rank. You can choose whatever specialty in any college you like. So have you finally made that decision? Because some of the candidates that you see the interview are still in a lot of confusion regarding which specialty to choose. Have you made your decision?
so sir, before giving this exam, I was very sure I would take up rheumatology because that is what I had practiced over the 3 years of my clinical PG. But during the course of selecting this seat, I started thinking about oncology, and so sir, I need to see more of both of those fields, and then I'll decide perhaps a week or so.
Okay, sure. You can connect to the doc tutorials, respective faculties as well, get their views regarding the priority of the colleges that you can choose on.
Yes,
So
sir.
finally, before concluding, Dr. Yash, what is the message that you want to give to all the aspiring students appearing for the next NEET assess?
So, sir, the most important thing that which I found out during this preparation stage was that the baseline knowledge that I had over 2 3 years helps very much. If you are, for example, getting 60 to 70% marks during your baseline test when you are starting to read for the tests, then it is very difficult to push for the extra 10 to 20%. So the baseline knowledge is the most important part of your preparation strategy. Yes, definitely last 2 3 months help, but reading over 3 years helps very much. So I think building a good base is the most important thing you can do in any exam, especially in an exam which is so generalized. So that is the most important thing.
Yeah, exactly, a very good message, because you just a last minute hurry and rush will not help you. You have to be consistent over a long period of time. We have already started the preparation group for the next year. You have to be consistent. You have to follow a specific plan that you have devised according to you, and in between give your grant test regularly to see where you stand. And in the end, doc tutorials will definitely help you in formulating as well as following up the revision. So finally, once again, a big congrats to you, Dr. Yash. Thank you for your time, and all the best for your personal and professional life. Thank you.
Thank you so much.